Hello, everyone. We are going to talk about a few important topics as far as your NEET exam is concerned. And, the NEET exam is very close. So these are 15 very important topics in the subject of prosthodontics, which we are going to take up and have a small discussion on what all you need to definitely know before going in for your exams. So let us talk about complete dentures, although there are multiple topics which are extremely important. But what we are looking at is the area where you get a lot of questions, and those questions are pretty simple to solve. So let us see if we are talking about, uh, just a second. Yeah. So if we are talking about the phonetics, what you commonly get in phonetics is something related to the S sound. So when you talk about the S sound, what we need to know here is that it is a dento-alveolar sound. That is the first thing. Secondly, it is controlled by the anterior part of palate, right? It is being controlled by the anterior part of palate. And what happens when this S sound is produced? When this S sound is produced, just a second. Yeah. So let us begin from the beginning part of it. So, what kind of questions do you get? The clinical importance of phonetics, right? So, when I'm talking about clinical importance of phonetics, if the maxillary teeth are placed too lingual, the sound T will sound like D, right? So, this incorrect position, whether it is too lingual or it is too labial, too forwardly placed, too palatally phased, what is the major problem? The major problem is with T and D. T will sound like D and D will sound like T, right? If the incisal teeth are set palatally, S will sound as TH. That is what you check when you ask the patient to speak Mississippi or you ask the patient to speak Saraswati, right? Why do you want to hear this S sound? Because this S sound should not be, when the patient speaks S, it should not come out like right? That is the problem. When you have an increased vertical dimension, you will always have clicking sound, right? The teeth are at increased vertical dimension. They are always in contact. That is going to lead to clicking of teeth. If the posterior border is overextended, what happens? K will sound like ch, ch. K will sound like ch. What about the whistling sound? When do you get this whistling sound in a complete denture patient? When you have these four important points here, right? High palatal vault, constricted palate, less vertical overlap, and more horizontal overlap. All this would lead to a whistling sound. If the upper anteriors are set too high, they are set too high, what happens? There is a gap between the upper and the lower anteriors. So when you say V, it will sound like F. Why? Because instead of contacting the lower lip on the outer surface, it is going to contact in the inner surface. And that is why it is going to be, you'll hear V as F. If they are too long, it will be exactly opposite, that the F will sound like a V. The S sound, which I was talking to you about, in S sound, it is dentoalveolar sound controlled by the anterior part of palate. That is why if the palate is thick, there is a problem in speaking S sound, right? Right? Now, what happens when this S sound is produced? The tip of tongue is near to the upper anteriors, right? It is near S. When you say S, speak S as we talk about it, and S, the tip of the tongue is near to the upper anteriors. The dorsum of the tongue is extremely flat, and the mandible moves forward and upward, right? It moves forward and upwards. That is what happens at S sound. So these are a few clinically important questions which come up when the paper is dealing with doubts on phonetics, right? Then you have heard about these two very, very commonly used terms. One is the real F effect and the other one is a snowshoe effect. Now, what is real F effect? This real F effect was coined by this term. Real F effect was coined by Hanau. So when you see a lot of Hanau principles are there, Hanau did a lot of work in complete dentures. So when you see Hanau's principles in that, there is a point called as Rayleigh effect. Rayleigh means the tissue, the complete denture is resting on the mucosa or the tissue. Now this tissue has got a resiliency and a life-like effect, right? So that is what is called as Rayleigh effect. So because of that resiliency, there are minor, even minor problems in a complete denture. They are all compensated by the behavior of tissue, right? That is what is called as the Rayleigh effect. Then comes your snowshoe effect. So if any of you have been to an area where there is snow, you always wear wider shoes, right? You have shoes which have got wide bases. So why is that? Because so that the entire force of your body is getting transmitted into a larger area. So force per unit area is less. The amount of stress per unit area is less, right? So that is called as the real F effect. The snowshoe effect. So as far as you cover up the maximum denture base area for a complete denture, you will be getting a good snowshoe effect.